Welcome back to All Therapists Are Jerks. This is Ulland.
And this is Jo.
We're starting off today's episode by following up on the previous episode where we had talked a lot about suffering and the Four Noble Truths. So if we have suffering, it's not like we just choose to accept it. It actually requires a fair amount of skill to accept suffering. So the next couple episodes we'll be looking towards skills to help us with reality acceptance in particular, and there are several skills that we can use along the way to help with this. Today's episode, we're going to be talking more about radical acceptance, which is a complicated skill to do and requires a lot of skills coming together to use it, but it is an important, I feel, kind of like a cornerstone to dealing with suffering. So it is an advanced skill to be introduced to, yet as we get more practice with other skills, things start to make more sense in how to use it.
Right. And I think radical acceptance is probably, you need a lot of mindfulness in order to be able to radically accept things. So obviously we're going to be talking about mindfulness in other podcasts. But I think the concept of radical acceptance is really important. And what I learned when I learned the reality acceptance skills, I learned that radical acceptance is kind of like your mind, body, and spirit, like full acceptance of something. And then turning the mind, one of the other reality acceptance skills, is kind of the more cognitive piece of it. Mm-hmm. And then, of course, is the willingness piece. And willingness is another one of the reality acceptance skills. And willingness is the action piece. So you still kind of have that like triangle, so to speak.
Right.
Yeah. So keep coming back to that base triangle. So radical acceptance is like searching for the of courseness of something. Mm-hmm. I think we spend a lot of time arguing reality, like it shouldn't be this way. And instead of looking like for, of course it's this way, there's no other way it could have been or could be. So when we're talking about radical acceptance, we're looking for the of courseness of things by accepting completely and totally that something is the way it is, that reality is unfolding the way it is. It's accepting in your mind, your body, your heart, and it's stop fighting with reality, which can really help us let go of bitterness, anger, shame. And I feel like radical acceptance a lot of times, it really is kind of paring things down to being able to grieve losses. Because I think we tell a lot of stories about why something is the way it is, or, denying that there's actually been a loss,
right,
which increases our suffering. So one of the equation that I learned, and I really love this equation a lot, is pain plus non-acceptance equals suffering. And I know we just did an entire podcast on like life is suffering. And so one of the things that I think maybe that equation can throw us off, it's not we're trying to get rid of suffering altogether. We're trying to reduce our suffering. So I think like accepting that life has pain and painful events, and how we choose to accept, not accept, or deal with those painful events can lead to suffering, or it can lead to freedom. Mm-hmm. The other flip side of that equation is pain plus acceptance is equal to freedom.
Right.
And by freedom, I don't mean freedom from negative emotion. I mean freedom of choice. We have choices on how we choose to deal with like what happens to us in life. Mm-hmm. But when we're in denial of the reality of things, it doesn't actually change the reality,
right,
and causes additional suffering. So if life is already painful enough, why are we adding more to it?
Right. And I think we've had debates before about the idea of life is suffering. Seems so strong to say it out the gates. And so I had my developmental way of looking at it, that I think that like babies don't have any skill. Mm-hmm. And it's like astronomically uncomfortable to, be in utero where it's comfortable and quiet and warm, and also just come out of this world that's way too loud. It's cold. There's all this bright light and everything. It's like immediately it's just uncomfortable. And then, babies have to learn how to start in small ways regulating their emotion. But a lot of this is through the rhythm of, being a mother and being a baby and that dyad.
Right.
So if we think about acceptance, so then really we want to know kind of more what has to be accepted. So we have to accept reality as it is. So facts are the facts, whether we like it or not. Kind of like you talk about, like if you wanted to be like an African-American basketball player, like 7 foot tall and be a professional basketball player, that's not really in the cards for you, whether you like that or not.
Yeah, nope. I'm like 5'8" and shrinking, and definitely a female white woman. So right. Yeah, that would be the, there are limitations on the future for all of us. Like we have to, but only realistic limitations need to be accepted. I think that that's a really important piece of reality acceptance. Mm-hmm. I think sometimes people can be born into certain situations or experience like a lot of traumas, and then automatically in their minds they believe that they can't have more than what they currently have or their station in life. Those would not be the type of limitations we would want to be accepting,
Right.
but we'd want to be accepting that there maybe are physical limitations. Maybe someone born with type 1 diabetes, like them wishing or resenting that they have type 1 diabetes doesn't help them live a fulfilling life,
Yeah, by not accepting it, like, I'm not going to take my medications. I want to be a normal person, not like anyone else. And meanwhile, we're having all these other consequences that are medical from, high blood sugars.
Right, causing suffering. And so, obviously that is a limitation on their future. There's only certain things that they can do with what they have. So really being able to recognize what is an actual limitation and what is a perceived limitation, I think is really helpful.
Mm-hmm. I think this other concept, which shows up a lot of different places within DBT, is that everything has a cause. And we talk about cause being very specific. It's a very objective way of looking at the word cause, much like a scientist would. If A happened, then A caused B. It's not necessarily like a story or a reason. Well, often we talk about reasons more like a subjective reason for things happening. Like, I believe this happened because my mom was mad at me, not like I was grounded because of my behavior.
Right. I like to use a really concrete example when we teach this. So I like to use the example of me kicking a chair, and then I have a pain in my toe. The cause of the pain in the toe was me kicking the chair. But then the story I might tell myself is, I'm a klutz. God, I'm such a klutz. That's why I hit the chair, why I tripped on the chair, which is an excuse or a reason versus a cause. Or I might even go into an anger statement of like, what idiot left this chair here? Like, oh my God, you're such an idiot. Why would you do that? Why would you leave the chair here? Now here I am in all this pain. That isn't the cause of the pain in my toe. The cause of the pain in my toe is the fact that I tripped on the chair.
Right.
How the chair got there is a completely different story, or
Right.
my level of awareness of the chair being there. But so you see what I'm saying, where
Right.
we're looking for causation versus reasons or excuses for it.
Right. And often I think to find the cause, you have to have observed what's happened. Because if you didn't observe it, then it becomes assumption or reasons or an unknown that you want to kind of have the certain story about something that may be uncertain, as though that's better. But I think often, or at least for the residents that we work with, the stories they come up with to explain these things are actually pretty negatively driven at themselves.
Right. And they believe those things then to be facts. So that
Right.
we'll get into that with mindfulness of current thoughts. But I think that just differentiating causation versus reason or excuse is really important.
Very important. I think also to add to, and I maybe wish I'd said this in the last episode or podcast, that even though there's a lot of suffering in life, and we've adapted to that suffering as a species, life is still worth living, even with painful events. That we don't have to be diminished by negative experiences in the past or traumatic experiences, and that we can still grow from them.
Right, exactly. I think you kind of talk about it a little bit when you're talking about like comparisons. Like, we have to be able to experience the negative in order to experience the positive, or to be able to recognize or value the positive. I mean, I like to, a lot of times my residents, when they come in, they'll talk about how life is, so painful, or they feel like they don't fit in because they're more emotionally intense. And then as treatment goes on, they're actually able to see that the way they see the world is they see the world very highs and very lows. But it's like brighter. I don't know if that makes sense. They see or experience things more vividly.
I believe so, yeah.
And so then they'll talk about like, I wouldn't want to be meh. That's what they say. I wouldn't want to be meh.
Yeah.
I don't know if anybody saw the emoji movie, but like the meh emoji, he doesn't want to be meh. He wants to be everything. And I think that is the beauty of being able to regulate emotion and accept emotion as it is, or accept reality as it is that we don't live a meh experience.
True. So there are a lot of reasons for why one might want to accept reality. I think that one of it is that, like you've said before, if you reject reality, it doesn't change it. Like, it happened. It's in the past. I think also important within DBT is one of the main dialects we have is this dialect between acceptance and change, and that change strategies work great, and cognitive behavioral therapy has so many good, and even behavioral therapy has so many good tools and techniques used to promote change. But if you're starting with someone before being on the acceptance ends of things, it's really less likely to work because you're not accepting someone where they're at. And that's important. Somebody might be at acceptance already, but they're already there, and then you can move to change. But for most people, I think on average, you have to work a little bit to acceptance first.
Right. And how do you even regulate an emotion if you can't accept the fact that you have the emotion? So in order to even be able to move into change, you have to accept what is actually happening in the moment.
Sort of like your current state is what acceptance is.
Yeah, it's like in the moment, accepting each moment as it is. Like that was an extremely painful event. It makes sense that I'd feel sad. You start moving into being able to validate yourself. But you can't do any of that if you can't accept what you're actually experiencing.
Right. I think also we can't accept pain. We have pain for a reason. It's meant to be there. Often if we're avoiding our pain, we're going to make it worse, which kind of talks back to your equation that you brought up earlier. Often in a longer term sense too, so we can reject pain in the moment, but also if we're doing like rejecting our painful experiences throughout a long period of time in our life, is that we're generally going to be unhappy, bitter, probably have a lot of anger towards people or a lot of shame towards ourselves.
Right. And acceptance often will lead to deep, deep, deep sadness. Mm-hmm. But once you're able to experience that sadness, there's usually a sense of calm that follows. Mm-hmm. I think there's a lot of times when we do a lot of shoulds, like that shouldn't have happened. I shouldn't have reacted that way. He shouldn't have done that. When we start doing the shame and blame, so we're anger and shame, we're not actually able to grieve. Mm-hmm. And we just peel it back to the fact that, well, this is a loss and the loss is sad and I have to be able to experience the loss. And sometimes these losses are irrevocable. Sometimes it's the passing of someone or a significant loss. But if we can't grieve it, we can't actually be able to move on. And then there's usually that sense of calm that follows. There's a lot of times I'm working with girls that have been inhibiting grieving for so long. And then you sit across from them and you just look at them and say, that's really sad. And then they just cry like they haven't cried before. And then afterward, they're like, I feel so much lighter. And like you're just able to experience sadness. And it isn't that bad. Right.
This thing they avoid that they feel like they'll never stop or they'll come apart almost. And so they try to fight it so much.
Well, I think it's because most of the time when they've been crying in shame, anger, or anxiety rather than just in sadness.
Right. It doesn't feel like they go anywhere afterwards.
And then I think the other thing that's really important is the path out of hell is through the misery. So refusing the misery forces us right back into hell. Mm-hmm. So all the ways that we tend to avoid whatever pain we're feeling, whether it's substances or self-injury or, constant suicidal ideation, binge eating, restricting, like all the ways, even binge watching Netflix, all the ways that we effectively, and by effectively, I mean, it works.
Like in that moment.
Effectively, short term, effectively, the way we avoid often leads to these longer term sufferings or a continued loss of connection, which perpetuates the suffering.
Right. And I think it's sometimes hard to radically accept because there can be some confusion about what it actually means, like to accept something. So often acceptance can be confused with other ideas. One is like approval. Like if you accept what happened, then you're approving of it, or it's morally okay with you, or that you're supposed to change your mind about something. But it's not really about approving of that event. It's just that it has happened. Also, it's not compassion. Radical acceptance is not showing compassion. So that might be more directed towards someone else who's having a hard time changing their behavior. That it's radical acceptance doesn't necessarily mean that it's compassionate because you're not doing something for that other person. You're doing that for yourself.
Right. And I think what stumbles people a lot with the concept of radical acceptance, I was actually having a conversation with a good friend of mine who is of the Sikh faith, and we were having kind of a heated discussion about this because it's a pretty acceptance-based faith.
Yeah.
And we were talking about this concept of radical acceptance, and he's like, that's BS. Like, you don't radically accept things. And I was like, oh, but I think you're confused. I'm not saying that it's okay. I'm putting my stamp of approval on it, and I'm just like laying down and accepting it. So a lot of times in radical acceptance, we say we have to recognize reality as it is. So it is what it is. A lot of people hear that as, well, it is what it is, as being very passive and like, oh, there's nothing I can do about it, so I'm going to throw my hands up in the air. Radical acceptance is actually a very active process that then allows us to change. So a lot of people, I think that radical acceptance is about, well, you just have to accept it. There's nothing you can do about it. You have to take it.
Right.
And it's actually the opposite of that. It's like, I have to accept it for what it is so I can figure out how to change it if I want to change it. But if we're constantly fighting it, we don't actually have the opportunity to change it. And so after we had that discussion, he's like, oh, I see what you're saying, but I think in our common everyday vernacular, and so often you hear people say, it is what it is, just throwing their hands up in the air, like, excuse my language, but fuck my life.
Yeah,
that's one of my favorites.
I'm a victim kind of thing.
Yeah, like, oh, fuck my life, or, I can't even, all these things, like, oh, life is just so overwhelming, screw it. That's not radical acceptance. That's the exact opposite.
It reminds me going back to like posts on Facebook or social media where they do this venting energy or look how bad my life is. And then like everybody else around is supposed to jump in and rescue them at that point.
Yeah, which leads to active passivity, which is another podcast I can't wait to get to.
Right, definitely.
Yeah.
So there are factors that interfere with our ability to radically accept. And just a big one is skills for acceptance, which we're going to get to be talking about a little bit in this episode, but also some future episodes after this.
Yeah, and there are a lot of skills. Actually, I feel like huge chunks of DBT are all about accepting, which obviously that makes sense, right? Distress tolerance and mindfulness that's the acceptance side of the dialect. Mm-hmm. And so we have to be able to learn those. We have to be able to become more mindful. We have to have the ability to tolerate and accept distress when we're in it. In order to be able to move toward change. And so that takes time. It's not like we just wake up one day and we're like, well, I'm just going to accept this now. Mm-hmm. Like we have to be able to be mindful that we're having the experience in the first place and then have the skill set to be able to tolerate whatever we're experiencing without jumping out of it, and especially in dangerous ways.
Mm-hmm. We also, like as we spoke about before, that choosing to accept a painful event doesn't mean that you approve of it. And it also doesn't mean that, nothing can be done to prevent a similar future painful event.
Exactly. And then the other thing that often gets in the way is intense emotions. Mm-hmm. So, and I think we've kind of been talking about that already, but, really intense shame and anger will get in the way of radical acceptance. We can't really accept something because right now we're currently fighting it. Mm-hmm. You can be angry at an injustice, and you can't actually change the injustice without accepting that the injustice has occurred in the first place.
Right. Sort of like, here's where we're at right now, mm-hmm. and I'm not okay with it necessarily, and it's where it is right now. And it doesn't mean that I can't activate to help change that or do my part to help improve something.
Right. And when you get stuck in those like anger cycles or shame cycles, you're not inclined to actually be able to move forward in change. So like the really intense emotions. And I do this a lot of times with my residents when we're talking about anger, because mm-hmm. I think anger sometimes gets a bad rap. Because we think of anger as like rage or like the type of anger that, causes you to blow up relationships. But I feel like, sometimes you have to have just enough anger in order to set limits with people, in order to, make changes like in your workplace, in your school environment. You have to have just enough anger to recognize that there is an injustice, to recognize that something isn't fair or equitable, or that someone else is being hurt. It's the dysregulated, intense anger that gets in the way. So I think some people start to become avoidant of anger, mm-hmm. Which sometimes actually anger does fit the facts. And sometimes you have to radically accept that the event does fit the facts for anger, but check your intensity of your anger.
Right. And I think also too, I know this is probably a little off task too, but like if you look at how society is with gender, and each gender tends to be also that how anger is accepted or expressed between genders can be very different.
Right.
And that so part of anger can easily cause disruption in relationships, which actually is shown to be more painful for the female mind than the male mind. So it's more of a concern. Also, being angry is not something that's really accepted as a feminine trait. But if guys or men are angry, then it's like maybe they're a go-getter, or it makes sense they're angry and it's okay and they'll cool down later. Mm-hmm. But then somehow it's socially inappropriate if a young woman or a woman would be angry. Mm-hmm. And so I think we see that a lot with residents we treat on the unit, where they're just afraid to even be angry. So they just immediately shame themselves for being that kind of person that would be angry at someone, even if it's justified.
Right. Exactly. And that makes it difficult for them to set limits and increases the likelihood of being exposed to unhealthy and unsafe relationships. Yes.
So it's something that's important to learn how to be assertive and not so passive.
Well, and I think that goes regardless of gender. I mean, I think that the gender point is a really, it's an excellent point. And I want people to be clear that it's, what's the word I'm looking for? He's better at my words than I am sometimes.
Well, not that it's you're defined rigidly by your gender.
Correct.
Like there are men who are more femininely minded, or mm-hmm. women who are more masculinely minded. So I view it as like, it's on averages, it's population studies. Right. It doesn't always apply to the individual. You could make a guess on average. Right. So, I mean, that could be talk in itself about how you look at population studies and statistics, right. But it's just how we in this culture kind of define a certain way of being feminine, and also is based somewhat in the statistics of mm-hmm. on average, and yet those smaller differences, which are actually small between genders, can get amplified in society in ways that are really unfair.
Right. Okay, so next we're going to move into how do we radically accept? Well, the first thing we have to do is observe that we're actually fighting reality. And the way that we observe that is, well, what are we saying about the reality? usually it's laden with a bunch of shouldn'ts. That shouldn't be like this. I shouldn't have done that. They shouldn't have done this. So that's a pretty good clue that you're not accepting reality the way it is. So like my example of stubbing your toe, when you stub your toe, like I should have watched where I was going, Ulland shouldn't have left that chair in the middle of the room. It doesn't really matter. I already stubbed my toe. And the more I grow this story of why I shouldn't have done it, the less time I am actually taking care of the pain in my toe.
Right. And then getting back to kind of the idea of that it is what it is, not in a passive or rejecting way, but part of it is like to try to remind yourself that the painful reality happened or it's currently happening and actually can't be changed. And then, of course, like your mind will run away from that and go back to wanting to change it or wanting to fight it, and you got to come back. So I think that even ties in with the Four Noble Truths. When we talked about the path, it's not like a decision like, oh, I did my radical acceptance, I'm moving forward. It's more like I did it, it helped, and now I got to do it again because it's coming back
to it.
It's like peeling an onion. There's layer after layer when you're grieving something.
When I learned radical acceptance, my awesome trainer, and if he ever hears this, I hope he doesn't mind the shout out, but Neil McGlowski, one of the things he said to me is that radical acceptance is a verb. It's not a noun. It's not a place we arrive. It's a verb. It's a practice. It's something we do, and it's something we have to do time and time and time again. And I think that really, really stuck with me. Yeah. So I appreciate that learning and that insight from him. So the radical part of radical acceptance is practice acceptance with the mind, the body, the spirit. Use acceptance self-talk and consider using relaxation, mindfulness of breath, half smile and willing hands while thinking of what seems unacceptable, which we're going to be doing a podcast on half smile, willing hands in the near future. I think that this is another one. And again, I'm totally stealing one of Neil's examples. Neil is the one who kind of gave me the toe example. Everybody has stubbed their toe. And if you think about what you do the minute you stub your toe, you usually start hopping around on one foot, cursing, like, oh, son of a, and you're hopping around and you're bouncing and bouncing and bouncing. And what he described to me and it really poignantly stuck with me, was radical acceptance, that moment where you take the deep breath, you breathe in, you're like, and you exhale and you let your toe go to the ground and you're like, yeah, that hurt. That is the full acceptance of the experience rather than like denying the experience, cursing the experience. It's like, yep, that hurt. And then I can move forward to go get my ice and my ibuprofen, and life starts getting a little bit better. And then opposite action, obviously, practicing opposite action. List all the behaviors you would do if the facts were accepted, and then act as if you've already accepted the facts. So sometimes radical acceptance is, most of the time, radical acceptance is not an easy thing to do. So sometimes you have to do some visualization or some thoughts of like, what if I were accepting reality as it is? What would that look like? And then you do the act as if principle, right?
Right.
So act as if like you've accepted the reality, which can then kind of help increase your willingness.
And sometimes that like also comes to finding a way to cope ahead for things, to be prepared if you're going to have to be exposed to that negative event again, or maybe that's a person that you're dealing with or something you have to kind of come back to again and again, that you can kind of have a plan for how you can radically accept in that moment by using skills and having a plan for it. And it's also important with, I think many things like knowing the sensations in your body are important, but also with radical acceptance is you're also exposing yourself to grief in some way. So really getting familiar with how that feels in your own body is helpful because really we kind of are, who we are is kind of how we feel in the moment. And it's often the avoidance of physical sensations that kind of worsens one's avoidance and one's rejection of their own reality.
Well, and I think the attending to body sensations piece of it is really important. And I think that's really hard for people in the beginning phases of treatment or the beginning of phases of like mindfulness. I think it's hard for people to even recognize body sensations because we could become so cut off from them. So being able to recognize I have a tightness in my chest right now, I feel like my heart is racing. Even observing and describing your body sensations can help reduce your suffering. Just paying attention to them and like recognizing that they're there without judging them, without freaking out about them. Like, oh my God, my heart is racing. I was like, okay, I'm noticing my heart is racing, and then practicing, maybe mindfulness of current breath and things like that. And then, of course, at the end of all of this, we still have to acknowledge that life can be worth living even with pain. I think we can all think back to, very painful losses in our lives, and yet here we still are, and we're still living, able to find joy, able to find happiness, able to experience love, despite significant losses. And those losses might inform, how we move forward in relationships, how vulnerable we choose to be, but to be able to recognize that life is still worth living, even with significant loss.
Yeah, also, too, we can find ourselves kind of fighting with ourselves, not really wanting to radically accept. And there are other skills that can be used, such as pros and cons, is to try to look at, what are the benefits to trying to radically accept and what are the difficulties of radical acceptance as a way to kind of mentally go back and look at, is this something I should be doing, or maybe I want to do it later, maybe I can't do it now. And that can be also helpful to add.
Can I give an example of this? Actually just popped into my head.
I like how you still ask for permission like all the time. It's hilarious.
Like I'm not going to.
I'm always like, yes, please.
Yeah, yes, please. So recently, actually, I don't know why I haven't thought about this when we're doing our education discussions, but recently I broke my wrist. And this was a good example of radical acceptance. So we were taking a resident who's getting ready to graduate. We were taking her ice skating as an accomplishment, like kind of a celebration of her time and her commitment to her recovery. And she hadn't figure skated herself for several months, but she's really talented. Yeah, an extremely talented competitive figure skater. And, she'd been with us for close to 90 days. And so I was like, oh, this is this thing we're going to do. It's going to be so cool. And jokingly in the car on the way there, I said, I hope I fall and hurt myself so I don't have to do your discharge tomorrow. So that was me, trying to avoid the sadness of goodbye. And tempting fate. And tempting the universe to slap me in the face. And then we get on the ice, and I had gone, I think, the week before with her as with the whole group, and I hadn't skated, in like maybe 10 or 15 years, and I've never been a good skater to begin with. And so we had gone like 10 days before, and I did really good. I stuck to the walls. I was doing my thing. I didn't fall. It felt great. And I was like, I can do this. And we get there, and we are on the ice for maybe 5 minutes, and I fall backwards and break my wrist. And this was this moment of like radical acceptance. First thought in my head, oh my God, you're such an idiot. I cannot believe, you got your old ass out on the ice and you're not even a good skater and you're a klutz. And so here I am in like complete denial, right? Right. And then I remember, oh yeah, and you tempted fate. You said you didn't want to do your discharge tomorrow, and here you are. And then I'm like sitting on my butt on the ice and kind of nauseous, to be honest. Right. And all of a sudden I look down at my wrist and I'm like, oh my God, it's broken. And then I get up, and like Ulland and the resident comes like skating over to me, and I'm like, I'm fine. It's fine. I'll be fine. That was not reality acceptance. Yeah, I saw your wrist and I was like, no, you're not fine. You're not okay. No. Nope. It might have been that big rush of opiates, but and then I'm sitting on the sidelines, I'm like, you guys go out and skate. It's fine. Like, what are we going to do? No big deal. And they're skating, and I'm getting more and more nauseous, and I'm looking at my arm, and finally I hit that moment of radical acceptance and that vulnerability piece of like, yeah, I think we need to go to the hospital now. Yeah, I was in that situation of like, well, I'm not going to fragilize you because you wanted her to have that experience and for us to be out there. And then in my mind, I was like, we got about 10 minutes and then we got to pack it up and get the hell out of there and get treatment. Yeah, so I think that is a good, it's a more physical example of the radical acceptance, but even the stories in my head that I was telling myself about it. And, and then you tell the story, and I think almost every member of my family is like, what were you thinking? You're such a klutz. I was like, thank you. Thank you for reinforcing my negative self-talk. It's not so helpful, and it happens. That's right. And at the end of the day, there's nothing that could be done about it. Broke my wrist, can't go back in time. So in our next episode, we'll be covering more of turning the mind and willingness as concepts and skills. This has been All Therapists Are Jerks with Ulland and Jo. And thank you for listening.